devastated by upper tract infection. And what is very unique for its type is the complete disappearance of this coughing once the patient sleeps. And usually, this patient have normal clinical examination, and he received many medical medications before and many doctor visits before without any response. And usually the age of the patients is between 8 and 14 years of age, but it may be a little bit younger than 8 years. So it's starting from 4 years, but this is the peak age incidence. Usually the patients get profits from this type of cough. He may get attention of his parents, and he gets school absenteeism, and this is usually what we say the psychogenic before cough. But actually the American College of Chest Physicians changed this term psychogenic cough into the term somatic cough syndrome. Why they confirmed it into somatic cough syndrome? Because these patients usually have a psychological disorders. And this type of cough is a sort of somatization of this psychogenic distress into physical symptoms. So that's why we determined that this type of cough is a somatic cough syndrome. As we can see here, the peak age incidence is between 4, but it is very limited number of patients, and increasing with age, and the peak between 8 and 14 years of age. And it is a chronic type of infection, as we can see here, the durations of cough lasting extending between just 1 month up to 12 months in some situations. We have many differential diagnoses of patients with chronic dry cough barking in nature like that patients. Like asthma, cough variant asthma, atopic cough, non-asthmatic eosinophilic bronchitis, whooping cough, tracheomalacia, post-infectious cough, vocal cord dysfunction, exercise-induced laryngeal obstruction, Tourette syndrome or Tourette disorder, and also the structural anomalies of the supraglottic, glottic, or subglottic lesions, or even the extratracheal part. This is another example of a patient. You can see these sounds. The mother is complaining from chronic cough since more than 3 months. We visited many doctors, ENT doctors with many medications, but all of them failed without any response. Clinically, it's completely free, physical examination is free, normal X-ray chest, and this condition worsens during stress and doesn't disappear during sleep. So, this is not a cough. This is just sounds. So we say this is the Tourette disorder or Tourette syndrome, or what cough tic, which is not definitely psychogenic cough or somatic cough disorder, but actually in that syndrome controllable, even motor disorder like eye movements or eye chin or mouth movements like that. We can get also vocal tics in which we have sudden uncontrolled vocal sounds. And these sudden uncontrolled vocal sounds may be grunting, barking, tongue clinking like that, sniffing, hooting, saying good things, or throat clearing, hissing, spitting, deaf, whistling, or squeaking, or hugging, or echoing sounds or phrases repeatedly at these type of patients. In Tourette syndrome, usually this is occur during sleep and doesn't disappear during sleep. And so that's why this patient have no true cough, but actually a vocal cord Tourette syndrome. Coming with back history of repeated attacks of hoarseness of voice with difficult breathing, barking of stridor, and chest tightness which require frequent PQ admissions with frequent intubations. Once intubated, there is no normal airway pressure and no autopay for the patients. Once intubated, soon the patient was normal. He received ICS for more than 6 months, but by proper technique without any response. And this is the normal history of the patients. Actually, this patient is suffering from what we say vocal cord dysfunction, in which the patient has difficult breathing, chest tightness, stridor, feeling of choking or suffocation, frequent cough which is barking in nature, voice change and hoarseness of voice. And actually, vocal cord dysfunction is a little bit difficult to estimate. And we have many literatures about the prevalence of vocal cord dysfunction. Some of these said that it is maybe so. For dyspnea are suffering from vocal cord dysfunction. And vocal cord dysfunction actually